Hello, I'm Phil Jacobus. It's July 24th at 10:30 in the morning. I'm here at my home in Woodstock, New York. Thank you very much for joining me. Today I'm joined by Rich Miller, but before we visit with Rich, let's take a brief moment to catch up on a couple of the latest news items on Healthcare Business News Online. Here's a story about a device developed by a Japanese university that protects healthcare workers from COVID-19 transmission during endoscopic procedures. A very interesting read. Next, we cover a study that suggests that ultrasound is as good or better than chest CT for COVID-19 studies. You might remember that we interviewed Diku Mandavia from Fuji, and he suggested that a hospital in Italy also found this to be true, and that generally hospitals have more availability of ultrasound than CT. Here we see that Martin Coombs has been appointed president of publicly traded BWX Technologies. So all interesting stories at Healthcare Business News. We're covering all of the latest stories in healthcare every day, and it's free. So please sign up to receive our online news. And now I'd like to welcome my guest, Mr. Rich Miller. Rich is the Chief Strategy Officer for QGenda. Rich, thanks very much for joining us today.
Thanks for having me on, Phil. I appreciate it.
So Rich, I have a little familiarity with your company, but for those who do not, and your service, from 5,000 feet in the air, how would you describe what it is your company does?
Sure. I think at its core, QGenda is it's a scheduling platform, a provider scheduling platform. But when we talk about what scheduling does, it's really about knowing who a provider is, when they're working, what time are they showing up, what time are they leaving, what are their core responsibilities during that time, what kinds of procedures and things can they do. So I like to think of it as an air traffic control system for providers, so we know where everybody is, what they're doing, and how we can best use them.
Now, during COVID-19, how has your service been used more or less? Do you feel it's helped, and if so, how?
Sure. It's been really interesting because as we kind of went into the pandemic, we had customers, especially our large health system customers, really come out of the woodwork and say, we've used your product traditionally to schedule all of our doctors and advanced practice providers, but right now we are surging in terms of our capacity in our acute and critical care areas. And we need to be able to schedule everybody in those areas. So we had systems that went from, 5,000 users of the system all the way up to like 30,000 users of the system. Every person was in there. The people who were doing the housekeeping, the laundry, and people who were, moving patients around, and orderlies, and techs, and medical assistants. Suddenly, they needed to schedule them with a tremendous degree of accuracy so that they could manage that just crazy capacity that they experienced. So we partnered with customers to have this, what we call surge scheduling, where we piled everyone into the system very quickly, within a matter of days, and let them operate in that sort of blown up environment to make their care environment more efficient.
That must have been quite a challenge. You don't inherently, you understand that when you're more organized and more efficient, that you're going to save money. Mm-hmm. But can you give me some examples of how this process has saved money or saved time? And Einstein said that time is money in a real life situation.
Mm-hmm. I think there are a couple of different ways. I think when we think back to our original value proposition we started over 10 years ago, it was really about helping people manage schedules more efficiently, build those schedules in an automated fashion, and reduce some of that administrative burden. But as we've progressed, we now, analytics is a huge part of what we do. So we're looking at demand, we're looking at the number of providers that we have on a sort of blow by blow, minute by minute basis. And it's really about matching the demand of the clinical area to the provider supply that's available, and making those two things really reconcile with each other as rationally as possible.
Yes. Do you communicate with the workers as well as the department heads, or do you leave it to the hospital to communicate with their staff?
Sure. I mean, one of the things that's exciting about QGenda is that everybody logs into QGenda lots of times every day to see what they're doing, to swap a shift with one of their colleagues. If there is a call for demand where they say, I need critical care nurses, I need 3 critical care nurses immediately from this hour to this hour, people will pick up those shifts on the application. So certainly the end user engagement, when you have over 300,000 people hitting a system every day to just moment by moment know what they're doing, that's exciting, and it means everyone is really informed. But of course, you have all of those schedule administrators, many of them support staff within the departments, who are really looking moment by moment at what's going on and using the system as a communication tool, as sort of a bulletin board to let people know what's going on, and also using an on-call system. So if I need to find an ENT specialist, I'm going to pick up my mobile app and I'm going to type in ENT and very quickly find the right person, have it ring right through to them.
It's really interesting. What do you, when you look into the crystal ball of the future, what do you see?
I think that pandemics are kind of theoretical until they hit. I think some people think in the modern era that medicine is so good that we would never really have to engage this exercise in a full way. And I think that every health system is going to be charged with dealing with the problem of surge planning and being ready to really schedule people with a high degree of accuracy very quickly. But I think one of the immediate things that's going on is the tremendous financial impact of the pandemic. So for a long period of time, you had all of your elective surgeries, all of your ambulatory business, tons and tons of billing just was wiped out. It was paused, and now we're starting to see some of that revenue come back in. But there is a huge revenue hole. Every health system right now is facing a financial crisis. So 10 years ago, when we talked about efficiency in the market, hospitals were like, efficiency, we're just worried about bringing in as many patients as we can. Now hospitals are really saying, we have to serve this patient population with a tremendous degree of efficiency to dig ourselves out of the hole that the pandemic put ourselves into. And then, going forward, I think you're going to see a big change of behavior where hospitals and health systems are going to be much more accountable in terms of their ability to provide access and the cost to provide that access.
Well, I have to say that this is a really innovative, I do have one more question. What percentage of the United States, of US hospitals, do you think utilize a service like this, whether it's yours or someone else's?
I think that all hospitals have some degree of scheduling, but when we talk about what we describe as enterprise scheduling, and enterprise scheduling means every physician is on there. Your on-calls in the same repository as where your schedules for your departments are being built. Certainly you see all the big players, Mayo, Cleveland Clinic, UPMC, New York Presbyterian, UC Irvine in California, UCSF. These are all clients of ours that are using the product in a very expansive kind of enterprise model. And we think that that's actually a fairly new market. Traditionally, our market has been addressed on a department by department basis. So radiology would buy a radiology scheduling system. Anesthesia might buy a different system. We're now seeing health systems moving over to an all-physician single system that can manage every domain, and even starting to see hints of bringing in nursing, bringing in those advanced practice providers, bringing in those support staff to create really harmonized areas of care.
Well, that's a very interesting idea. My hat's off to the person who thought of it. I want to thank you very much for spending time with us today. I hope we'll check back with you in a year when things are better and see how things are going.
That sounds great. Thanks so much for your time today, Phil.
And thank you.